So, Dr. Kath, we're back. You came back into general practice at a point where you were already feeling exhausted. What made you stay with the work and try and reimagine it rather than step away from it altogether?
I guess a large element was it's what I've always done. I went straight from school to medical school, straight into GP training. So it's always been my work. And I think when you're worn out, it's quite hard to think about doing something different. That feels really scary. But also on the practical level, my life was set up to expect that I would be earning money as a GP. So there was always also that kind of financial consideration, really.
So a lot of the work they've been doing has been shaped into practical tools, the 12 habits for sustainable practice, the 6-step framework. What were you trying to create for clinicians that you felt was missing?
So I guess I was kind of trying to create practical tools that people could use within the realities of NHS consultation times, 10, 15 minutes, that I think would have helped me 5 years back where I was feeling really stuck. So it's really taking a very practical approach and a very realistic approach to support people to practice in a way that maybe feels quite different to what they're doing at the moment.
For someone hearing about this work for the very first time, what difference does this approach make in the room for people, both for the patient and for the professional?
So I think there's a real synergy in terms of the shift that this approach can create both for health professionals and for patients. And that's really themed around making sense of our experience, both as patients feeling stuck, but also health professionals feeling stuck, creating a sense of agency, so focusing on the things that we can do rather than all the things that we can't do or the things that we need other people to do for us. And this idea of creating momentum, so creating momentum beyond the consultation and creating momentum beyond events like this, so giving people tools and a sense of community that they can lean onto once they're beyond the conference that help them integrate these approaches. So there's a real sense of synergy between those two aims.
So the Sustainable Healer Conference is now in its second year. How does it feel to be back in that room and see so many people engaging with the principles that you brought forward in the first place?
Yeah, I mean, it's really wonderful. You know, it's really heartening, it's really uplifting. People have responded to it. I mean, the main word that people were using in the build-up to the event was excitement. And I don't think it's often that you see health professionals describe about being excited about the work or being excited about an event, and I really love that. So it's a real sense of a building community, not just a community restricted to this event, but a community across the board within health professionals who maybe recognise that there is another way that we can practice and that there are small shifts that we can make that can have a big impact for us and our patients.